Hello again. So this is our last part of the lecture on important devices used in obstetrics and gynae. I am briefly going through instruments used for instrumental delivery. So in instrumental delivery basically means the patient needs help um, in the second stage of labor to deliver the baby. There are many indications which may discuss separately. I'm not going into those details. The one which is commonly used these days, it's called Kiwi. It's a vacuum delivery cup, and I believe I have shown you this already, right? So Kiwi is basically, it is not connected to any machine. It's quite useful. It's quite effective, and it causes minimal. The risk is minimal compared to forceps or other methods of other types of vacuum cups. So it can cause harm to baby, but the risk is minimal compared to other instruments, and it can cause perineal tears, but the risk is less compared to other instruments which are used for delivery. So this is how it looks like. This cup is applied to the baby's head, and this handle is used to create suction, and this is a disposable device. So that means it can only be used once. As a result, in underdeveloping countries, usually a kiwi is not used because it becomes expensive and it's disposable. So instead, in developing countries, underdeveloped countries, either this silastic cup is used, but this needs to be connected to a machine to create suction. Okay, so it is more stronger compared to kiwi, but so that means it leaves uh, more a deeper mark on baby's head. It can cause more there is increased risk of perineal tears to the mother, and so it is connected to this suction machine. Okay, and usually it is controlled by a paddle, and the paddle is under the operator's feet. You may never see it if you work in the UAE. So because in the UAE and in the developed countries, kiwi is used only. So instead of this silastic cup, we can also use a metallic cup. So metallic cup is very good in delivering the babies, but again, it leaves deeper marks on baby's head. Okay, and again, it needs connection to this suction machine, and the operator controls the pressure with the help of a pedal under their feet. You may never see these devices. They're still used in many countries. Okay, so to apply force the vacuum, it needs to be a certain point on the baby's head. Okay, that's why it is important to know exactly the position of the baby's head. Otherwise, if the position and station of the baby's head is not known, it is very easy to have a failed instrumental delivery. Okay, so then we can have forceps. So forceps, these are the delivery forceps, right? They come in different, they have different names, and they come with different sizes. These ones are the Wrigley's forceps. We have them on campus. Even I think I have shown you. So Wrigley's forceps, even they are part of the cesarean section trolley, because sometimes forceps need to be applied even at the time of C-section. Okay, so there's these are Wrigley's forceps. These are the easiest ones. Like when it's very easy, when the head is really low down, then they are applied. Then these ones are, so the middle-sized ones are, they are called either the Neville Barnes, they look similar, or this one is the Simpson's forceps. But usually Neville Barnes are usually used for like when the head is kind of not too low but not too high. So Neville Barnes are usually used. Okay. And then the third one, which are the most traumatic ones, they are called the keyland forceps. Keyland forceps are very traumatic because they are the only type of forceps where head needs to be rotated. Okay, so for example, Neville, Barnard, Simpson, or even Wrigley's, they do not rotate the head, right? For example, from occipito posterior to occipito anterior, they are not used to rotate head of the baby. They are just used to pull the baby's head out. That's it. But these Killian's forceps are also called rotational forceps because once they are applied, we can rotate the baby's head from occipito, for example, transverse to occipito anterior, okay, or from occipito posterior to occipito anterior. So that means they can cause more trauma, and even they can be applied. Just look at them; they are longer compared to the rest, right? So they can be applied even the baby's head is high, okay. So and they come with this thing lock. They are identified first by the length, right? They are longer, and secondly they have a lock there. Okay, and third is like they are rotational because the blades slightly they are made differently. Okay, in general, these forceps, all of them, they have three main parts. First is the blade, shank, and handle. Okay, so these are called the blades, right? They can be separated as you could see when you were on campus. So every forcep, they have the pair have two blades, two, like one is for left, one is for right. Okay, and which one is left and which one is right, it depends on, like for example, this one will go to maternal left side, right? So this one is the left. Okay, and this one will go to the maternal right side, so this one is right. You don't need to remember, but I'm just telling you that. So this part is called blades, then shank, and then these are the handles. Okay, now the next one is a device which is used to monitor baby's heartbeat. Okay, it's actually connected to the CTG machine. Now, see, some women, they are, if they're in a lot of pain, they keep moving, right? Especially if they don't have epidural. And for some women, if they are overweight or if they have a lot of adipose tissue on the abdomen, it may be difficult to monitor baby's heartbeat through the CTG abdominal probes. In that case, what is the best thing? So this device, okay, that's the fetal scalp electrode. Okay, this is attached to the CTG machine. Okay, so this goes to the, it is connected to the CTG machine, and then this little thing, this clip kind of thing, it has a little, this thing, electrode, which goes into the scalp of the baby, into the head of the baby scalp. Okay, it does not cause trauma to the baby, it's just a tiny thing. Okay, so but it is attached to the head scalp of the baby, and then CTG monitoring is performed. Okay, so but to do this, what is needed? ARM should be performed. Okay, so it cannot be, of course, performed with cannot be applied with intact membranes, right? If the membranes are intact, which means they are in place, it cannot be performed. So that means ARM should be performed first, and then fetal scalp electrode monitoring is done. So it's actually the CTG, but the at the end, the instead of using the abdominal probe, this device is used. Now again, I'm coming back to the checklist before starting contraception. As I said, so this general one is more for when using before for oral combined oral hormonal pills. Okay, but say for example, if you have to assess eligibility for intrauterine copper device, for example, then you do not need a lot of medical background. But what you need to know, see, we know that, for example, copper device, what does it cause? It causes heavy menstrual bleeding. What does it cause? It can cause pelvic inflammatory disease. So in history, at least, you should know about these at least two things, right? And then of course you should know the age of the patient. Does she need more children? Like for how long does she need to have contraception, right? Is she breastfeeding or not? When was her LMP? Because she should not be pregnant. Same is with Myrina, right? We should know whether she has been having heavy bleeding because it will benefit her. Then with Myrina, but we need more detail because it's a progesterone, right? So if she has a previous history of breast cancer, for example, it should not be given to her. But again, if there is current active pelvic inflammatory disease, right, we should not give her. Well, for even copper device, there should not be a history of ectopic pregnancy. Okay, so for yes, it's good if you can go through all of this list, but this is specially for combined pills or the hormonal ones, right? But if it's just a, say for example, copper device, you may not need to go through, say for example, anti-tuberculous drugs or anti-epileptic drugs. If you ask, that's well and good if you have time, but so depending on like if you are asked to get a full-fledged history for contraception, you have to go through all of this. But if we specifically ask you to assess her eligibility, say for example, Myrina or copper device, then you need to kind of specifically ask the relevant questions. Okay, so hopefully we will do this when you're back on campus, and that's all for this